better keep it on right now. Thank you for joining me today. I want to sign two bills here, then I'll go to the podium and make some comments. But it's important to put an exclamation point on some bills that are passed, and particularly whenever it's part of my agenda, that gives me an opportunity to give an update on where we are on the legislation this year. And so the first bill is House Bill 1343, and I want to express thanks to Representative Les Warren for his leadership, as well as Senator Rapert. And this is a law enforcement support bill for the Arkansas State Police that reduces their retirement age from 30 to 28. This is something that is much needed with our state police to equalize them with the retirement provisions for the rest of state government, and they serve our state so well. So this will help as an incentive in recruitment and retention of our incredible Arkansas State Police troopers. So thank you all for doing this and leading the effort, and I'm pleased to sign this today. And this is the 23rd day of March. There we go. Thank you, Senator.
Thank you, Governor. Can we shake now?
Yeah.
Thank you. Appreciate that.
Thanks, Les.
Thank you, Governor.
All right. And so that goes to the second bill. Thank you, gentlemen.
Thank you very much.
And the next bill is, I don't know whether Secretary Cook is here or not, but she worked hard on that last bill as well. No, this is Senator English, of course, and Representative Vaught, who has led the effort in the legislature to pass Senate Bill 107, which is to create the Computer Science Education Advancement Act. This is a huge step forward among many steps that we've taken in advancing computer science education in Arkansas. And this bill requires that a computer science course be taken as a graduation credit. In other words, to graduate from high school in Arkansas, you either have to have a computer science course in the career technical field or in the core subject field, and that gives you a credit, but allows you to graduate, and it can be considered as a science or a math credit as well. Thank you, Senator English and Representative Vaught, for carrying this important legislation. And I'm going to sign this.
It's our pleasure.
And March 23, 21, it is signed. And just let me comment that this bill allows Arkansas to stay in the forefront of national leadership on computer science education. We have led for 6 years our nation in a comprehensive computer science education program. This takes it up a notch further. There's only one other state, South Carolina, that's done anything like that, and so we are still in the forefront, proud of the leadership that the legislature has given this effort to give all of our students the opportunity for computer science education in our high schools. So thank you, Senator English.
Thank you very much.
Thank you. And thank you, Representative.
Thank you, sir.
Thank
you.
Let me, now that I'm back at the microphone, let me just make a couple of comments about this legislative session, that sometimes we just look at what grabs the headlines or the latest controversy, and we forget the very substantive work that's being done in this session. And I'm very pleased that we've already signed the task force bill with a task force on the future of law enforcement. That bill has passed through. It's been signed. I think we have a picture here of the signing of that bill, which included those representatives from the task force. And this will enhance accountability, training of our law enforcement officers. And this came after the George Floyd protest across the country and the terrible tragedy of his death. And it allows, we set up the task force that made recommendations on legislation, and this has been passed and signed into law. I've just signed the state police retirement bill and the computer science bill, and so there's 3 parts of my legislative package that has been signed into law. Yes, that's the picture of really some of our great task force meetings. We were the young protesters in civil protest about their concern on police violence. They were brought into the task force with law enforcement officers, and they worked together to accomplish something that was good for Arkansas. Very proud of them and that effort. And then we have a number of other bills that are in process. The teacher salary increase has been a priority of mine as part of my legislative package. It is passed through the House and it is headed to the Senate. And this is designed to raise the average salary in those school districts that are currently below the medium salary for teachers. We've had really 2 different systems in Arkansas, one of the more prosperous districts that have recruited teachers and paid them more, and then you have our less prosperous districts that have been below the medium average. This helps those districts that have been below to raise all of the teacher salaries here in Arkansas to the medium level. And Secretary Key is here, who's worked hard on that. Thank you for your leadership on it. And hopefully that will get through the House. It's going to be considered today in the House Committee. And we've reached an agreement, as you know, on the Emergency Services Act, which was part of my goals for this session. And with the great work of Representative Gazaway and Senator from Bryant, I'll think of his name in a second, that they worked hard on this. We reached an agreement on it. Senator Hammer, yes, Senator Kim Hammer did a good job on it. We're very satisfied with it. And the first presentation on this is the extension of the emergency that I've asked for another 60 days. That will be presented next Monday to the Legislative Council, and that sets the stage for that. What remains to be done would be issues of tax cuts, $100 million in the long-term reserve fund, and the needs-based scholarship. So it's a good point in the middle of the session to reflect on what has been accomplished in terms of my particular agenda, but also the work that still remains to be done. I want to thank all the General Assembly that has made these substantive bills possible and this progress for the state of Arkansas. Now with that, we will begin our COVID update. Let me stop though, just to see if there's any questions in regards to the legislative side of this before we go into our COVID update.
Any thoughts early on here to the women's sports bill that was just delivered?
That just, I believe, got to my desk the last few days, so we have a process to go through. As I've said, I agree with the purpose of the bill and the intent of it, but whenever you're entering into a new area of legislation, you want to look at it carefully just to make sure there's not any unintended consequences. So we're going to look at it, but I agree with the intent of it, and I will continue to study it until we make that final decision.
So we had some rock stars here this morning presenting the bill to allow for student athletes at the college level to be compensated for their name, likeness, and image. Seems to have a lot of support early on here. Kind of what are your thoughts on that? And if it gets to your desk, do you know what you'll do with that one yet?
I haven't studied it completely, but here again, I appreciate Speaker Shepard and his work on this to put Arkansas really in the forefront of taking care of our student athletes, to make sure that they are adequately protected, but they also, it can be used as a significant recruitment tool and a competitive advantage perhaps. So I like the direction of it. Again, I want to study the bill, but I'm favorably disposed to that bill. With that, please let me ask Secretary Romero to come forward. He's here. And we got Secretary Key, and we have Colonel Ader, who's our program manager for vaccination distribution across Arkansas. And then we have a special guest today, Dr. Margie Scott, who is with the Central Arkansas Veterans Health System for an important announcement a little bit later. And let me begin our COVID weekly update with saying it is very good news what we have continued to see here in Arkansas. And let me first put up the graph in reference to vaccinations. This is a very significant day that should be marked, and that is that we have administered in the state of Arkansas 1 million vaccinations. Now, this is under the CDC reports. That's 1,466,000 vaccines have been presented to Arkansas, and of that, 68.75% have been put into the arms of Arkansans. So we have administered over 1 million vaccines in the state. Now you say, well, why is that different from the figure that we have in terms of our state program? And the answer is that this includes, on the CDC report, those that are separately handled through the federal program of our Bureau of Prisons, Federal Bureau of Prisons. It would be handled through our Veterans Health Centers that vaccinates veterans separately, and Dr. Scott will be talking about that. So it includes all of those, and if you include all the vaccines that come to Arkansas and how many Arkansans, how many have been administered, it's over 1 million. And I told Dr. Romero that I had a goal by the end of this month to be at 1.1 million, so we're getting closer. And so this is good news. We want to continue that progress. And to the case report, this is a continued story of good news. Our total active cases are down 69, and so our active cases are less than 2,300. And whenever that active cases are going down, that portends well for the future. In terms of our actual cases, it's 239 new cases over the last 24 hours, which is up obviously from yesterday, but it is down from a week ago. The deaths is sad that we have any Arkansan that still dies from COVID, but we have it down to 3, so that is encouraging to see those numbers go down. If you look at our hospital data, our hospitalizations have reduced by 11, and our ventilators have been reduced by 2, those on ventilators. So the testing is still at a modest level, and the fact is when people don't feel threatened or they do not feel ill, they're not going to get their tests. Now, we encourage them to whenever they have symptoms or they've been traveling, but our testing will probably continue at that lower level, and that's why the other indicators are so important. When you look at the vaccinations at our state level, again, the state program, then the federal programs, and those are federal programs that go through Walgreens and the community pharmacies. It does not count what goes through our veterans healthcare system, which is a large number of doses that go through there. We just received 68,000 additional doses. We've given out 14,000, plus the federal programs is 4,600. We spoke about this earlier with Colonel Ader, and I'm not happy with the speed of distribution, and I think we're running into a little bit of a continued demand problem in the sense that as people in their communities see lower case numbers, they're less motivated to get a vaccination. And we've got to reverse that trend. I want to ask everyone, when it's your turn, get a shot. Get that shot in your arm, because it helps our entire state to completely move out of this pandemic. And so we need everybody to get vaccinated, and our providers are going to have to help us to reach out to our businesses and to our manufacturers and to our schools and other congregate settings in order to get everyone vaccinated and to push it a little bit more than what we're seeing at the present time. We do have 340,000, which is over 10% of our population that is fully immunized. And then if we'll go to, I just wanted to show this to you. This is a daily average of cases, confirmed and probable cases in Arkansas. As you can see, we've been on a steady decline, but as I spoke with Dr. Fauci this morning, I asked him to look at where we are, and the test is, are you going down or are you flat? And if you're flat and you stay flat, then there's a potential you go up. And Dr. Romero, I think, has reiterated that point. Right now we're going down, but we want to make sure we do not plateau and have the potential to go back up in the future, and that's why it's continued important to pay attention and get vaccinated. I want to end, before we turn this over to Dr. Romero and then Dr. Scott, I'm making 2 points. We're going to have an additional increase in vaccinations next week. I was on the phone with Jeff Zients of the Biden Coronavirus Task Force, and he announced that there will be additional vaccines that will be coming to the state of Arkansas this week, which was not, we thought it was going to be more flat, but there will be an increase. And then I also wanted to mention spring break again. We have our students that will be coming back from spring break, and some of you have seen some of the scenes from Florida and Miami Beach, and I'd like to think that our Arkansans might not have been there, but I suspect that some Arkansans were there. And I know that many will be coming back from spring break. If you've traveled, if you have not kept your social distance, if you've been in crowds, please get a test when you come back. Make sure that we don't reinvigorate the virus whenever we've got it at a low level on our campuses, in our schools, and our teachers, everyone. When you're traveling and you're in settings that could lead to contagion of the virus, please come back and get a test and make sure everyone is protected. With that, let me ask Dr. Romero to come, followed by Dr. Scott with the Central Arkansas Veterans Services.
Thank you, Governor, everyone. So quickly to state what the Governor has already said about the travel and spring break. We are concerned that individuals who have traveled, students, other individuals, will have been infected while they're enjoying their spring break. It's very important that we not allow this virus to resurge in the next 3 weeks after the spring break. So please, if you have any symptoms, even as a precautionary measure, consider getting tested shortly after you return. And please don't ignore any symptoms. With regard to vaccination, let me just say this. We've done a good effort so far. Our biggest concern at this point is vaccine reluctance, or that the public has become somewhat complacent with the fact that we've had such good numbers, that we're seeing less cases, less hospitalizations, certainly less deaths. Now is the time to get immunized. Now is the time to become vaccinated. We do this for all of our vaccines. So we don't wait until we have a measles outbreak to immunize the public, the children, for measles. We don't wait until the middle of flu season to begin vaccination for flu. So now is the time to push forward because, as the Governor said, we cannot fully and safely economically open up the state without risk of re-triggering this outbreak if we do not have a sufficient number of individuals vaccinated. Within the Department of Health, we are pushing forward to do that. I'm proud to say that as of today, we have 60% of our population, of our employees vaccinated. We are offering repetitive vaccine clinics, and we're going to do the same for any department of the government that wishes this. We want to get to 70 and above. So please, take that vaccine. It is safe. It is efficacious. We now have a vaccine that gives immunity after 1 dose. Take that if you don't want to get two pokes. So please, let's not let up our guard at this point. Thank you.
Thank you, Governor, for this opportunity to speak to our state's heroes, our men and women who've put on the uniform and served this great state and this great country, our veterans. And on the slide, the first slide, you'll see that I have a very exciting announcement. We began our journey with the CDC recommendations of looking at the highest risk populations first. And given the supply of vaccine, we've been able to increase the eligible population of veterans for the vaccine. And we are currently offering the vaccine to all eligible veterans 18 and up who are enrolled in VA health care. So no longer an age limit, and we're very excited about that. If you go to the next slide, these are the areas where we emphasized initially, homeless, hemodialysis, chemotherapy, those in community living conditions, and then essential workers, of course, as well. But now all enrolled veterans who are eligible for health care at CAVHS. The next slide. You'll see that where you can get your vaccine, and we're very excited to say that from the beginning of the pandemic and the beginning of the vaccination efforts, our motto has been COVID-19 does not take a day off, and we will not either. The men and women of the healthcare system have been there 24/7, and since the day we received the vaccine for COVID-19, we've been vaccinating veterans every single day, every weekend, and every holiday. So if you want to get your vaccine, here's where you can go. The John L. McClellan Hospital, Monday through Friday from 7:30 a.m. to 4:30 p.m. We take walk-ins, they're welcome until 2:30, and we do that to make sure we don't waste any doses of vaccine. There's a convenient drive-through now at Fort Roots, North Little Rock, and that's 7 days a week, Monday through Sunday, 7 days a week, 7:30 in the morning until 6 p.m. in the evening. We want to give opportunities for those veterans who work to be able to get there after hours and on weekends. And if you live near any of our community-based outpatient clinics, you can call them for an appointment. We're giving vaccines in each of the CBOCs at least once, many times twice a week. And we're also rotating Saturday opportunities at each community-based outpatient clinic. So we want to make this vaccine available for all of our heroes in Arkansas. We're one team, the federal, the state, serving together to end this pandemic. The next slide. And Dr. Ramirez spoke of this. The wonderful news of hitting over 1 million vaccinations given. At CAVHS, at Central Arkansas, we've given more than 20,000 vaccinations. Nearly 14,000 veterans have received their first shot. More than 6,500 have completed the series, and we keep vaccinating each day. If you add Central Arkansas and Fayetteville, Veterans Healthcare System of the Ozarks, the VA has vaccinated more than 26,000 veterans and staff thus far, and we're continuing that journey. The next slide. We want to make sure that you understand the COVID-19 vaccine is safe and effective. There are a lot of myths out there. The COVID-19 vaccine will not make you sick. You will not get COVID-19 from the vaccine. The side effects are minor. It will not alter your DNA. You've heard all of these things in the social media particularly. The vaccines are safe, they're effective, and they're absolutely free to enrolled veterans. Next slide. All right.
Thank you, Dr. Scott, and with that, we'll take any questions. And we do have Secretary Key here, who said he had a very boring education report because their cases are very, very low. People are going on spring break, but he's here to answer any questions as well.
What is that case report?
What's that?
What is the education report?
There has not been a district that has shifted to virtual instruction due to COVID since the first week in February.
With testing numbers on the lower end, are you considering doing more surveillance testing, say in schools, prisons, nursing homes? That way you can keep getting a better idea of the cases out there.
We would like to, and of course we've tried to have a surveillance program in place. We have It's difficult in the school environment. We try to do that with our antigen test, if you remember, and there was some resistance to that among the schools and the parents. And it's not really any different now with the low case number that it's hard to get participants in a surveillance testing program. We would want to continue to look at that. We'd have to invest in additional resources as well, just simply because much of the same staff that does the testing would be doing the vaccination. And so there's a concentration of our effort right now on the vaccination, getting those out. But as we have the resources and the demand, we'll try to increase our surveillance testing as well. Dr. Merrill, do you have anything to add on that?
So testing in long-term care facility continues. That we're continuing to see that, and we continue to process that. So we are monitoring those sites, but everything the governor has said is correct.
If the biggest problem we're having with the vaccines is the reluctance, why not just open it up to everybody 16 and over?
Well, the answer to that is that we have parts of our state in which citizens that are in Category 1A, 1B, or 1C, they can't get an appointment. So there's still, you've got a varied part of the state, but in Northwest, some of the urban areas, it's very difficult to get an appointment, and so we've still got a backlog there. And we look at, like right now, we're in 1C. That includes our inmates, and we have not got them fully vaccinated yet. And so we want to get a greater percent of those that are in 1C done before we move on, but stay tuned. I expect that we'll be able to move that direction in the near future. Yes?
What additional steps can you take to help with this issue of vaccine hesitancy and demand?
We're doing a very extensive ad and educational campaign that you see on television, influencers, people that the community would identify with. It's also on social media, so there's a massive advertising campaign. We're also enlisting the support of employers and others that can participate in that. State government is a good example. I've challenged all of my cabinet to reach a 70% goal of vaccinations within state government. And part of that is bringing in a medical doctor or others that can educate the team members on the need for a vaccination. And so we're doing all of that, and that's one of the ways that you can overcome the resistance that's out there.
Mask mandate expiring at the end of the month?
Of course, the March 31st is when I said the mask mandate would be lifted if we meet certain criteria. We are far below that criteria, so everyone can expect on March 31st for that mask mandate to be lifted. Now, we've got some more work to do to make sure that we can articulate it in the right way and have the appropriate guidance for our cities, for our employers, for our school systems. And so we're meeting on that, and we want to finalize that by next Tuesday so that we will be able to make the final decision on the mask mandate, but also provide further guidance for others that might be impacted by lifting that mask mandate. We're getting a lot of questions from businesses. How does this impact us if we want to keep the mask in our store? Well, that's a prerogative of business, and so we want to make sure that what we do doesn't impede important decisions that are made out there at the school level or within some businesses.
Keep their own mask mandates.
I would expect this to be a statewide. We've always moved as a state on significant issues, and so I would expect when we lift the mask mandate that that will include everyone. Now, as I said, schools will probably have the local option so that school districts can make a different decisions if they wish to, and I know some schools have already indicated that. So that's just a little bit of preliminary information on what we hope to announce next week, but that's the direction we're going and the expectation that we would have. I don't know whether we have anybody remotely. We do.
Governor, this is Josh with KEIT.
Right.
I was curious, your mask mandate that would come up would be at the end of March, which would also coincide with the incubation period of spring breakers coming back. Any thought on delaying the mask mandate a week or two to see if there is that impact, since both you and Dr. Romero talked about and stressed the importance of spring breakers coming back?
Our emphasis on the spring breakers coming back, get tested, take the right precautions, and in terms of the mask, I'll make that announcement next week. But as I said, we set certain criteria that if we met that from a public health standpoint, and the public has done that, we've met those goals. So I think I would be roundly and appropriately criticized if I backpedaled from the commitment that we made and the announcement we made on March 1.
Governor, this is Samantha Boyd with KNWA. You just touched on this, but I want to clarify about the statewide mask mandate. Will cities have the option to enforce a mandate or not?
No. We're going to go on this together, and so, you know, it's a one statewide standard is what I expect to announce next week.
Hi, Governor. This is Allie Lynch with 5 News in Northwest Arkansas.
I hear Channel 5.
Congressman Womack met with you yesterday, Governor, along with other state leaders, about ramping up vaccinations, specifically in Northwest Arkansas. Has there been any thoughts or plans to distribute more vaccines to that area?
Absolutely. It was a good conversation with Congressman Womack, and Dr. Romero was there along with Colonel Ader, and he's right. In the 2 weeks ago, there was numbers that showed Northwest Arkansas, the 3rd Congressional District, not having the same number vaccinated as some other parts of the state. And so we were increasing the doses there. We've got a mass vaccination clinic planned again, and so we're trying to make up for that and equalize that across the state. So he was right on point, and we're addressing it.
Governor, this is Governor Michael Wilson with 5 News. I have a question about the legislation that you vetoed yesterday about restaurants not being able to get refund on any funds that they received during the peak of COVID. Would you be able to explain why you vetoed that bill?
Certainly. Of course, it's expressed clearly as to the reasons in the letter that I sent with my veto to the General Assembly, but let me make sure it's clear that this is a separation of powers issue, as well as wanting to support the incredible public health professionals that tried to achieve compliance in our businesses during this time of the pandemic. And when I say a separation of powers issue, that it's the legislative branch to set what is a violation of the law and not, and what's the appropriate penalty, and then it's the executive branch of government, which is the governor and the administration, that enforces the law. Now that we've enforced the law, the bill would come back and say, well, we disagree with that enforcement, we want all those fines refunded. That is a violation of the separation of powers. And so I understand where they're coming from. I disagree with it. That's the reason I vetoed it. It would undermine the rule of law, and it would undermine all of those that worked hard as businesses and restaurants to comply, which was 90% of all of our businesses. And we're saying, you worked hard to comply, others didn't, and we're going to refund the fine to the others. I think that would be counterproductive to the good health that we need in our enforcement policies. Did I hear Andrew DeMillo on there?
Yes, sir. Thank you, Governor. Wanted to ask you a couple questions related to legislation. Going back to SB 354, the transgender athletes legislation, you talked about unintended consequences. is part of a issue that you're looking at what impact this would have on the state in terms of NCAA events if this is enacted? And also wanted to ask you more broadly, you've got this on your desk, you've got the medical conscience bill on your desk, and there's also legislation dealing with health care for transgender youth that's working its way through the legislature. Do these bills, are you concerned at all about the message that they send about Arkansas to LGBT people, especially transgender youth? Do you share any concerns that this will make the state come off as not welcome to this community?
Well, I hope everybody looks at these bills very fairly, and you know, a lot of accommodation has been made in the different bills that are coming forward, and I don't want to lump them all together. There's some that are ones that I would have problems with. There's others, like the women in sports issue, that seems like a very worthwhile objective to attain. I certainly will want to listen to any concerns by others. If there's any NCAA issues, I certainly would like to know about that. And so that's why, because there's so many, we wait till they get to our desk, we evaluate those. I'm giving a heads up that I think that women in sports bill makes sense, but I want to look at it more carefully before I make a final decision. In terms of the overall message, I want the message to be that we want to make sure that everyone is protected, that everyone has equal treatment under the laws. That is very, very important, whether it's transgender or whether it is some other characteristic. And that's the message I hope we can send as a state. And I think one good way that we can do this is to have an effective, what we've called a hate crime bill pass, or where we have increased penalties and time in prison for those that violently target another group, whatever that group is. And I think that's important to balance out this legislative session. I know there's many that are working hard on that, but that's, I hope whenever the session is over with, you look back and see that it was not just focused on one thing, but there was a lot of substantive issues that were accomplished and a good balance. And then I hear another question from a TV reporter.
Governor, it's Maureen Gillespie with Channel 7. I did want to ask you on the latest with PUA. You still got about 25,000 Arkansans who have not been able to receive any type of PUA payments over the last few months or so. I understand the National Guard being called in to help out with ID verification events. At this point, a year into this, you still have about 25,000 Arkansans who have not been able to get paid in several months, some for 6 to 8 months. Can you comment on that?
Well, yes, I was briefed on it this week. I asked for different options to accelerate the processing of the claims. There's a large number that are batched as potentially fraudulent, and you have to have ID verification. We do not want to be approving money and claims that are fraudulently based. We want to make sure we can focus on those that are legitimate and get that money out the door. And so that's one of the reasons we have some assistance from the National Guard for 30 days. I hope that we can look at the private sector to help us to finish the job, but they have focused on it. They have a plan to accelerate the processing of those claims. It's just a matter of implementing that and getting it done.
Governor, this
One
is
more
Samantha.
question, one more question if you don't mind. Just one more quick question. I know that you had commented on some things that Andrew DeMillo asked, but specific to the Medical Ethics and Diversity Act, it's my understanding that opponents say it's going to provide healthcare providers the option not to treat certain members of the LGBTQ community based off of religious reasons. That act is sitting on your desk. Do you have plans to sign that?
Well, again, that just reached my desk. I'll be reviewing it, but it is important to note in my brief review of it thus far that it allows, based upon a religious exemption, you can decline to do a particular procedure. You cannot decline to treat a certain category of persons. And so that's a change that was made in the bill that, and they've made a number of other changes in the bill from 2 years ago when it was not passed through the legislature, and I opposed it then. But those changes, they have made accommodations to some of the concerns that you just expressed. We'll continue to review it. Is there one last question?
Yeah, Governor, this is Samantha Boyd with KNWA again. I have just one more question. Is there any concern about schools now having desks only 3 feet apart, and if that'll impact cases at all right now after spring break, especially with students not being vaccinated yet?
I didn't really hear. Did you hear that? I'm going to ask Secretary Key to answer that.
So we continue to work with Dr. Romero and his health team on the revised CDC guidance. We do know they released that guidance, and this is part of what we are putting together for the governor's review for going into next week. But we're working very hard to make sure that the layered approach is something that has helped us succeed in having a successful school year to this point. And we want to help districts with the right guidance to make sure the appropriate layered response is still in place.
And let me come back to the table because you all have been very patient. Was there any other question? I want to make sure you all are covered here. You all actually show up. All right, hearing nothing, thank you all very much for your attention today and your opportunity to talk about both the legislative session and the 1 million dose mark in our vaccinations. Thank you.